Sitting down at a table, you look at a piece of steak and you're saying, if I chew this, is my teeth going to land out on the plate with the food? Chewing gum couldn't do that either because it stuck onto the denture and it clattered around your mouth. Speaking to people without the fear of the denture loosening up and falling out. Since I got these, no problem, I could talk away all day. The blessing during COVID was a face mask going out. I didn't have to worry about my teeth, but after COVID they were so loose. It took over my whole day from the time I got up in the morning until I went to bed at night. This constant thinking about keeping these things in my mouth without they popping out. It was a full-time job. I heard loads of horror stories about people going out to Turkey and people come back with these turkey teeth and having to go back months later and having to get them removed and no proper aftercare.
Been laying in bed crying as to what the I was thinking getting these teeth done. It is what it is now, there's no going back. I'm stuck with them.
Here at least you come back once every 12 months to make sure everything's okay, or if there was anything wrong you get an appointment to come up. There isn't a fix-it-in tube anywhere now. In my shopping list, practically every week there was a tube, a fix-it-in on that thing. I had to go to the bathroom if I was talking especially. Oh, I have to fix these before I get on the plane. Get off the plane, straight into the bathroom, fix them again. Make sure that they're tight enough. They're all gone.
What was the main issue with your teeth before treatment that was affecting your day-to-day life?
The denture continually kept being ill-fitting, for want of a better word. I had a partial denture before I came up here. I had a couple of teeth knocked out in sport. I've had a denture for, I suppose 30 years possibly. Somebody recommended implants.
And you mentioned that you were playing sport, that you lost a few teeth playing sport. What sport did you play?
Camogie.
Okay.
I got a slap in the jaw of a hurley and it knocked out. That happened when I was 16. I was continually having extractions and then there was no way of holding the partial denture I had. I had a chrome and cobalt denture, which is one of the best you can have, and continually was getting loose. Probably the gums were shrinking a little bit, and as the extractions, as I was taking out my teeth, they were getting bad. It just wasn't fitting anymore, and I was continually going back to my dentist to get it fixed, tweaked, and it just didn't work anymore. Trying to hold what I had and trying to get a denture that I could smile with without danger of it falling out of my mouth, which was my one big issue. I was afraid that the thing would fall out of my mouth when I was talking to people or laughing, or even having a cough. The danger was always there that the denture would pop out when it was getting loose. A couple of times it was quite close, yes, quite close, and you'd kind of have to put your hand up to your face and, try and cover the bloop. There was no roof plate on it. It was only clipped to my far back teeth. When the back teeth went, there was only a kind of a cup to cup onto the gum. There was no suction to hold it in. I had to continually be careful. Couldn't smile, couldn't laugh. I was afraid to laugh. You just didn't smile anymore. This fix-it-dent, that only lasted a certain length of time because it worked its way out of the gum area because the area wasn't big enough to hold it in. I had fillings from a very young age. Most of my teeth were filled at the time I was 17, 18, and I think it was just trying to maintain them. They just kept getting progressively worse. There was no keeping. An abscess would flare up in your gum and there was nothing you could do. I was actually reading something on Facebook about implants. I had spotted that the bone grows around titanium, the implants, these butts or stubs that they put into your gums. So I was wondering, so I spoke to my own dentist. It was very early stages. He said possibly. I didn't go back to it for ages and ages because I was maintaining my 7 teeth I'd left on my upper jaw, and I was trying to maintain them as long as I could, possibly because I was worried about the implant, how I would cope with it, having something foreign in your mouth. I saw an advert for Truly Dental then, and I contacted somebody, and I sort of left it again then for another long time. About 18 months ago I decided, yes, here goes, it's time to get something done with this. The denture I had to carry around fix-it-dent or that gloopy stuff with me every day. It had to be in my bag, it had to be in the car, it had to be, because if I was speaking to anybody I had to glue these things in my mouth before I opened my mouth.
And what kind of toll does that add to your, say, day-to-day life where you're constantly in your head thinking, I have to be conscious of my smile, this might pop out now?
The blessing during COVID was there was a face mask. When I was out or going out, I didn't have to worry about my teeth, but after COVID they were so loose and so took over my whole day. From the time I got up in the morning until I went to bed at night, this constant, continually thinking about keeping these things in my mouth without they popping out. It was a full-time job, apart from my job at all, it was a full-time job. I shied away from all presentations, I just I didn't have the confidence to do anything like that. I worked with medical devices, and you'd be asked to do stuff on and off different times to do stuff. I just shied back from them. I didn't want to know about them. I was lucky enough that I was able to stand back from those things, that I didn't have to do them. So I just wouldn't put myself forward for anything or speak, because I was afraid these things would pop out.
Between like your colleagues and your family and friends, did they notice a change in you, and they were saying like maybe you're a bit more in yourself than you had been in the past, just because they could maybe tell that you were less willing to smile in certain situations?
There was no smile. I couldn't smile. I couldn't speak and smile, because I was afraid. My brother said it to me. God, he said, you can talk. You're speaking very well now since you got these things done. I said, yes, because I'm not afraid. It was always in the back of my mind that the denture would land out in my lap. Eating out, you're continually afraid that the denture will come out of your mouth when you're eating as well. Sitting down at a table, you look at a piece of steak and you're saying, if I chew this, is my teeth going to land out on the plate with the food? Chewing gum, couldn't do that either, because it stuck onto the denture and it clattered around your mouth. Lots of things. The biggest one is speaking to people and being able to speak without the fear of the denture loosening up and falling out. Since I got these, no problem, I could talk away all day. My older grandchildren noticed. I was better able to talk to them, take them here, speak to people normally. Kaylee, my eldest grandchild, said it to me. They often pass comment on my lovely teeth, how well I looked now with my teeth, and my comfort. I'm very comfortable in myself with them as well. Before I could get up in the middle of speaking to somebody and have to go to the bathroom to glue these things in, just in case. And then my kids, the grandkids, when they say, Nan, you look so well with those teeth now, you look so well. You're smiling more and you're talking more and you're doing more things with them, which is true, yeah. From the time I'd get up in the morning until I go to bed at night, these things in my head, it was always in the back of my mind, this thing can fall out. If you're travelling and it goes off to sleep, you don't know if the thing is going to pop out either. It was always there, and the tubes of Fixodent. There was one in my bag, there was one in my pocket, there was 2 or 3 in the car, they were in the bathroom, they were everywhere. Half used, trying to hold the denture in place, even though it was a very good denture I had. I went through college thinking about this denture, because that side of my mouth was gone, the teeth on that side was gone, there was 5 of them gone on that side. And I went through college with a denture. So at that time I did my best to hide it. It fitted better as well because there was more teeth to hold it in place, but it was still a denture, like it was still there.
Say you had the implants in, they kind of feel like your teeth after like a couple of months, or maybe even quicker than that. Was there any kind of satisfaction in, say, throwing out all those tubes of Fixodent you had in the car?
They're all gone. There isn't a Fixodent tube anywhere now. In my shopping list, practically every week, there was a tube of Fixodent on that thing. I had to go to the bathroom if I was talking, especially going flying out. I have to fix these before I get on the plane. Get off the plane, straight into the bathroom, fix them again. Make sure that they're tight enough, just in case you meet somebody that you have to talk to. The toughest part of the implant is the first 3 months when you have the temporary one in. You just have to be careful with that. You're not chewing anything with it because they will break. You get used to that. Mash your potatoes and veg. Like 3 months is nothing. What is it? 12 weeks. That's it. There's no going back. That's it. It's there. It's not going to fall out. You can bite into anything. Bite your apples, your pears, your fruit, your steak, your meat. You can bite anything. It's not going to fall out, and they're not going to break. Now I wouldn't go chopping nuts or anything with them, or opening bottles of beer or anything with them. But they're not going to fall out. They're not going to break, and that to me is invaluable. I couldn't put a price on it. People were saying it's going to be sore. It's going to be this. It wasn't. I just followed medication that I was told to follow, and there was no pain. The discomfort after pulling a tooth, there was a slight bit, but there was no pain, there was nothing.
Coming to Truly Dental, would you ever describe yourself as a nervous patient as coming to a dentist?
I never liked going to a dentist. First of all, my teeth weren't that good. There was always something to be done, and I just dreaded the drills, I dreaded the injections, I dreaded everything. I was worried about coming to a different dentist. I met Dr. Jimmy, and it was like it's like I knew him all my life. Couldn't be more reassuring, is the word I'm probably looking for. Walked in, I thought, gave him my date, and I thought, here goes, this is it. Knew what he was doing, explained everything so well, what was going to be done, what he was going to do, and gave me my instructions to control the pain afterwards, and I just didn't have any problem with it afterwards, nothing. I took the medication as he advised me to take it. As far as I'm concerned, I just sailed through it, and I think majority of people would do. if they didn't have this fear either.
Did you have any sedation?
I had to have sedation because he extracted, I think, 6 or 7 teeth he extracted that evening, and put in the abutments for the implants, and I had to come back the following day then to get the temporary bridge in. That was in August, I think, July, August. So I was to come back in November for my permanent bridge, but I actually broke the temporary bridge before I came back, so I had to struggle for a couple of days with that thing. It cracked. Eating a Pringle, it happened on a Tuesday or Wednesday or something. I was coming up here on the Friday to get the permanent. That was the only problem I had, and I couldn't even call it a problem because I caused it myself anyway, you know, but it wasn't a problem really. There was no pain either, like there's no pain.
And say, working with Dr. Jimmy, how was that?
Fabulous. I couldn't praise him more. I've spoken to more people about that man. His personality, his way of dealing with people. He has a fabulous way of dealing with people, reassuring you. I've never actually come across somebody who explains their job so well and what they're going to do. You're there in the chair with your mouth open and he's continually reassuring you. And it was over in an hour and a half or an hour and 3/4 or something. It was so fast, so done and dusted. But I remember him talking to me. He's second to none. His knowledge, I've spoken to people at home about him, I've spoken to umpteen people about him. And he does come into my conversations, like if somebody says something about getting dentist, or I don't like a dentist, or I don't like going to the dentist, I don't like this. Well, I can tell you there are nice dentists out there. There's this guy.
In terms of someone taking like photos, say in the past you might have been at the back of the room or something, or maybe like hiding your smile. So say now, if you were to show like how you would smile for a photo now, how would you pose?
Real wide is wide. Totally different. I couldn't smile, especially in maybe the last 5 years before I got on. The denture was getting looser and looser. The danger was, if you smiled, like the thing was going to pop down. Either that or you had to have so much fixed in your mouth. It's not the nicest thing in your mouth either. Wouldn't be the best in your stomach. As it's loosening and going down, you know, it does go down to your stomach.
Has there been any, say, special occasions or events since you've got the implants in that you were like particularly delighted that you had your kind of new smile for?
Oh yeah, I'm fully retired. So my retirement party, I was able to, you know, just smile and talk and whatever. No fear of anything falling down. I think that was the biggest one for me, being able to sit and talk to people at my retirement party, you know, because everybody was looking. They'd be all looking at you, they'd come in shaking hands. Previous to that, there's no way I'd have sat for 4 hours anywhere talking to people. I couldn't, because I'd have to be gone out maybe every half hour out to the bathroom, fixing my mouth. Life changing, other than people going out to Turkey, and I just couldn't. I wouldn't have gone out there. I heard loads of horror stories about people going out to Turkey and going wherever, I don't know where else they're going, and you get people come back with these turkey teeth and having to go back months later and having to get them removed and no proper aftercare. Here at least you come back once every 12 months to make sure everything's okay, or if there was anything wrong you just phone them and they'll, you know, you'll get an appointment to come up.